Hi everyone, we are going to solve all the questions of psychiatry which were asked in a recent FMGE exam. Every time we are expecting at least 7 to 8 direct questions from psychiatry and 4 to 5 questions from psychopharma. This time also we have got approximately 13 questions from psychiatry. Let's see all the questions one by one. A female patient of bipolar disorder who was on lithium for last 1 year. Which of the following side effects is least likely to occur? So here in this question they have asked side effect of lithium. Remember, lithium is always an important topic, especially side effects of lithium, which I have taught you in detail during my class. Lithium toxicity. Remember here, lithium is a toxic drug. First of all, we can understand some points related to lithium. Remember here, half-life of lithium is 1.3 day. And lithium achieves its plasma concentration only after 5 to 7 days. Only after 5 to 7 days. So especially when we know that lithium is a toxic drug, we have to do TDM, therapeutic drug monitoring. First, TDM should be done only after 5 days. So basically, whenever we are going to start a patient on lithium, we have to be very much cautious. We have to be very much careful that there can be lithium toxicity. And first, therapeutic drug monitoring should be done after 5 days of starting the patient on lithium. Now, let's see here, what are the side effects of lithium? See, lithium can affect so many parts of the body. First of all, when I talk about CNS, yes, there can be tremors, right? Okay, fine tremors, right? Now, fine tremors. Okay, fine tremors. Suppose if there is only fine tremor, we can easily help with the help of beta blockers. But suppose if patient is having coarse, right? So now we should understand that now there is what acute lithium toxicity. How lithium is going to affect endocrine system? Lithium is disturbing TSH hormone. And remember here, lithium will cause hypothyroidism. Lithium will cause hypothyroidism. And we have to be very much careful, especially when the patient is a female. There will be very, very high risk of hypothyroidism. So whenever we are starting a patient on a lithium, we have to do thyroid profile test after every 6 months. After every 6 months to 1 year, we have to check thyroid profile test. What about GIT? Yes, this can cause nausea and vomiting. Yes, this can cause nausea and vomiting. What about a renal? Remember here, lithium will cause polyuria. And because of this, there will be polydipsia. And now, because of this, there will be secondary diabetes insipidus. Secondary diabetes insipidus. So remember here, yes, this can cause nephrogenic diabetes insipidus. For this, how do we treat? Remember, how do we treat? We have to give what? Fluid replacement therapy. We are also using, especially for diabetes insipidus, now we have to use thiazide diuretics. Thiazide diuretics. We can also use spironolactone, right? Remember, see, one more important point which I have discussed during my class. Remember here, what is the interaction between lithium and thiazide? This was the question of last time MCI exam. Okay, so last time they have asked, what is interaction between lithium and thiazide? Remember, whenever we are going to start a patient on thiazide who is already on lithium, please remember, thiazide can cause lithium toxicity. So whenever a patient is already on lithium, and because of secondary diabetes insipidus, whenever we are going to start a patient on thiazide, we have to decrease the dose of lithium. Why? Because thiazide is going to decrease the lithium clearance. Thiazide is going to decrease the lithium clearance. Because of that, there is very high risk of lithium toxicity. So remember, thiazide causes lithium toxicity also. What about the skin? Yes, so there can be, there can be rashes, even folliculitis, right? Even folliculitis. And do you think lithium can cause some problem if this will be given during the pregnancy? Yes, this is having a teratogenic effect. Remember here, lithium can cause abstinence anomaly. Abstinence anomaly, heart defect. But if I ask you one question, whether lithium can be given during the pregnancy or not, if there is the need of lithium, because we should know that lithium is one of the most important mood stabilizers. I would say gold standard mood stabilizer. My question is that lithium can be given during pregnancy or not? Answer is yes. Answer is yes. Please mention it. Because the risk of abstinence anomaly is very, very less. Risk of abstinence anomaly is 1 is to 1000. So remember here, if it is needed, yes, it can be given with the drug monitoring. Yes. Okay, now let's see all the options one by one and we can easily rule out. Do you think lithium can cause hypothyroidism? Yes. What about option number B? CNS side effect? Yes. What about option number D? Do you think there can be diabetes insipidus, nephrogenic diabetes insipidus? Yes. But when I see option number C, remember tardive dyskinesia, right? No, see here, this is the side effect of antipsychotic drug, especially typical antipsychotic drug like haloperidol. So answer is C, tardive dyskinesia, right? Now, next question is actually a one-liner question, I would say direct question. A person has consumed multiple tablets of benzodiazepine. What is the treatment for overdose? Basically, they have asked antidote for benzodiazepine poisoning. Very easy to understand. We have learned multiple times. Answer is what? Flumazenil. Flumazenil. When we talk about option number C, fomepizole, yeah, this is given for what? Alcohol poisoning, right? All right. Okay, next question. What can be the most probable diagnosis of image given below, which was recovered from the stomach after a surgery, where patient had alopecia of unknown reason and abdominal pain? I have taught you in detail in psychiatry, in eating disorder. There is something called as pica, appetite for non-nutritive substances. And one more disorder we have learned, which was earlier called as impulsive control disorder, hair pulling disorder. And what is the term we are using for this? Hair pulling disorder? Trichotillomania. Earlier it was called as impulsive control disorder, but now this is considered as a type of OCD, hair pulling. After hair pulling, a person can eat the hair, which is called as a pica disorder, and this is called a trichophagia. This is called as trichophagia. Now, when a person will keep on eating the hair again and again, again and again, again and again, yes, there can be some complications for sure. Yes, there can be GIT obstruction. And especially which part of GIT will be obstructed? Especially duodenum part 1. And now, hairball obstruction in GIT, that is called as what? That is called as trichobezoar. That is called as trichobezoar. We have learned in detail. Because of this, because of hairball obstruction, there will be some complications, yes, like obstruction, like abdominal pain, and yes, because of that there can be GI bleed also, right? GI bleed also. So yes, see here, alopecia of unknown reason, especially in the young female, right? And abdominal pain. So because after that radiological investigation is needed where black hairball will be seen, and what is the final solution here? Surgical removal. So after surgical removal, this is the presentation. This is the case of trichobezoar. This is a case of trichobezoar. Answer is C. This is the case of trichobezoar. Last option is only surgical removal. Okay, this is not Billroth surgical procedure, Billroth 1 and Billroth 2, which you have learned in your surgery, especially in GIT, right? Where we have to perform gastroduodenostomy, gastrojejunostomy for the gastric ulcer, right? So this is not Billroth. So this is not removed stomach. This is a case of trichobazor. Trichobazor. This is repeatedly asked question. A patient in OPD is very much obsessed with some particular things. He seems to be stubborn and frugal in nature. As per Sigmund Freud, sexual stages of development, fixation would have happened in which stage? We have learned in psychoanalysis. I have taught you 5 stages of sexual stage of development given by Sigmund Freud, father of psychoanalysis. See, in the beginning it was said that a person can derive sexual pleasure only because of genital organ. Sigmund Freud said that even a 1-year-old child can also derive pleasure. Even a 1-year-old child, even a 2-year-old child can also derive sexual pleasure. So he divided into 5 stages. And he said that as per the age, as per the development, sexual stages are divided into 5. And out of these 5 stages, there can be fixation at any one point. There can be fixation at any stage. And fixation can lead to development of some other psychiatric disorder. So let's see here. I have taught you the same table I have taught you in my class. Remember, 5 stages: oral phase, oral stage, anal, phallic, latent and genital. Oral stage 0 to 1.5 year, anal stage 1.5 to 3 year, phallic stage 3 to 5 year, latent 5 to 12, and more than 12 genital stage. So what Sigmund Freud said that a 1-year-old child can also derive sexual pleasure, but his behavior is different. The way he is deriving the pleasure is different. In the age of 0 to 1.5 year, a child derives sexual pleasure by biting, by chewing, by sucking, right? So I can say by biting, right? By biting, by sucking, by chewing, right? And 1.5 to 3 years, during this stage, when a child will be trained for, actually for the toilet, right? Okay. See here, up to this much age, if a child is deriving pleasure because of this action, this is fine. Up to 3 years, it's fine. But even if a 9-year-old boy is deriving pleasure by the same action, now what does it mean? It means fixation has happened at anal stage. And this can result into OCD. Remember, this can result into OCD. This we have learned in psychoanalysis. In the same manner, we have to understand about phallic stage. Now, at the phallic stage, age duration of 3 to 5 years. During this stage, a boy child, he will sexually be attracted towards his mother. And a girl child, she will sexually be attracted towards her father. Remember, son and mother. Okay, this is called as Oedipus complex. In the same manner, daughter and father. This is called as Electra complex. Up to 5 years, okay, up to 5 years, this is fine. But suppose if a 15-year-old boy is there, and now he is having sexual attraction towards his mother, for sure, he is going to develop some kind of anxiety. Oh my God, how could I think like this? How could I think like this? Because of this kind of anxiety and stress, he can develop a kind of psychiatric illness. Remember? So it means what? Fixation has happened at phallic stage. Now this can result into hysteria. This can result into dissociative disorder. Very, very important. And remember, when I talk about latent stage, during latent stage, a child is sexually inactive. A child is sexually inactive. A child will focus more on learning skills. After 12, main center of attraction will be genital part only. Remember, fixation at latent and genital stage can result into neurosis or any kind of neurotic illness. Now, what about oral stage? Fixation at oral stage. Since this is the beginning part of life, fixation at oral stage can result into so many psychiatric illnesses like schizophrenia, a kind of personality disorder also like dependent personality disorder, a kind of mood disorder also like depression, substance addiction also, especially alcoholism, Remember, we have learned all these points. So see here, when I talk about OCD type, obsession type, right now, stubborn and all, right now. So remember, see here, we can add a stubborn here only, stubborn type, fixation at anal stage, in which age duration 1.5 to 3 years. Remember, answer is anal stage. Earlier, they used to ask about Electra complex, Oedipus complex. This time, they have asked about fixation, right? Fixation. Next question. Which of the following is not a feature of pseudo-hallucination? I have taught you everything during the class. I used to ask you one question, how to differentiate pseudo-hallucination and a real hallucination. I used to ask with the help of one question which was asked last time in AIMS. A person is saying that, doctor, I can hear some voices and these voices are originating within my own mind. I feel very restless. What is the answer? Option 1 is auditory hallucination. Option 2 is pseudo-hallucination. Most of the students used to mark, sir, auditory hallucination, right? No. Answer is pseudo-hallucination. Why? Let's understand this part. Because there are 4 criteria to diagnose real hallucination. Remember, first is what definition? This occurs in the absence of any stimulus. So this is the definition of hallucination, that there is nothing but you can see something. Means false perception in the absence of any stimulus is called as hallucination. First criteria, there should be nothing. Okay. Second, it is as vivid as real. Means exactly the same. If a patient is describing something, this should exactly be the real. Third, experienced in outer objective space. Patient will complain, yes sir, I can hear some voices, but these voices are coming from out of the wall. बाहर से आवाज आ रही है. These voices which I can hear, these are coming from out of the wall, outer objective space. This is a real hallucination. If a person is saying within my own mind, sounds are originating, it means what? Inner subjective space, pseudo hallucination. Easy to understand? And this is always involuntary. Whenever patient wants, he cannot hallucinate, right? So there are 4 criteria to diagnose true hallucination. Against these 4 criteria, it will be called as pseudo hallucination. Now what is the answer here? Pseudo hallucination, right? So this is not vivid. Okay, voluntarily it can occur with a stimulus, pseudo hallucination. But when I talk about outer objective space, this is for real hallucination. This is for real hallucination, not for pseudo hallucination, right? No, outer objective space. Very easy to understand. Most of the time they used to ask the definition of hallucination. This time they have asked in a reversed manner, pseudo hallucination. So always remember 4 criteria to diagnose the real hallucination, which I have taught you before, right? Okay. Frugal and Capgrass syndrome, delusion of misidentification. Whenever I used to teach you schizophrenia, I used to teach you delusion of misidentification, right? And every time I used to say that Capgrass and Frugal are extremely important. Every time they are asking, right? Capgrass syndrome. But this time they have asked in association with any organic mental disorder, with a dementia. First of all, let's understand the meaning of Capgrass syndrome and Frugal syndrome. See here, these are what? Delusion of double. When patient is claiming that when a real person is replaced by an imposter, when a real person is replaced by an imposter. This is called as Capgrass syndrome. This is called as Capgrass syndrome. Patient can say that she looks like my wife, but she is not my wife. She is replaced by any imposter. Remember here, when one real person is replaced by an imposter, this is called as Capgrass syndrome. What about Frigolis syndrome? Here patient will be complaining that one known person can change many appearances, right? That is called as Frigolis syndrome. See, remember here, basically these are what? Delusion of misidentification. Delusion of misidentification. Remember this part here. Here they have asked about Capgras syndrome is associated with which of the following condition, and all are what? Related to dementia, organic mental disorder. See here, when I talk about delirium and dementia, one important point I have told you that in delirium, there is what? Disorientation to time, place and person. Sudden onset of symptoms, right now? Disorientation to time, place and person. You can say altered sensorium or clouding of consciousness, right? So that is called as what? Disorientation to time, place and person. Disorientation to time, place and person, which is also called as altered sensorium, clouding of consciousness or mental confusion. But in dementia, which is a slow and progressive disorder, there will be impairment in the cognition without any disturbances in consciousness. In all dementia, there will be no mental confusion except one, which is called as dementia with Lewy body. Dementia with Lewy body. Here there can be altered sensorium. So remember here, yes, here there can be misidentification. This is called as, so remember here, yes, out of these four, what is the answer here? Capgras syndrome can be associated with dementia with Lewy body. Dementia with Lewy body. And next question, which of the following is a key feature of depression? See, depression has always been a favorite topic, right? I have taught you out of 9 to 10 symptoms, minimum 5 symptoms should persist for at least 14 days, right now, for more than 2 weeks. Like, what are the symptoms? Most importantly, lack of mood. Most importantly, lack of mood, right? Lack of energy, sleep, insomnia problem, lack of psychomotor action. Obviously, after that, what will happen? See here, no? A person is not sleeping, a person is not eating, so loss of weight also, weight loss, loss of weight also, right? After that, see here, so because of all these symptoms, yes, there will be what? See, when I talk about lack of mood and all, patient will also be complaining, sir, I'm not enjoying in old activities. You can write anhedonia. Inability to experience the pleasure in old activities. A patient can say, sir, I do not enjoy in old activities, or I do not enjoy at all, right? Okay, after that, like some other symptoms like lack of attention, lack of concentration, lack of energy, negative thoughts, suicidal thoughts, obviously suicidal thoughts, feeling of guilt. Out of all these symptoms, minimum 5 symptoms should be there to diagnose a patient as a case of depression. But in this question, they have asked what is the key feature of depression. So most important point which we should mark is low mood. Answer is B, low mood. Simple. If I have to choose only one option, it should be what? Low in mood. This is the answer. Next question. Postpartum day 5. A female presents with complaints of restlessness, difficulty in sleep, insomnia, sadness, and irritation. What is the most probable diagnosis? After delivery, yes, mother can have a fluctuation of mood. Why? Because there will be imbalance in hormones, right now? Like most important hormones like the oxytocin, and the progesterone and the prolactin. And these are the most important hormones which can affect serotonin. And we have learned in physiology also that serotonin is called as happy hormone, which is responsible for good food, good mood, and good sleep. So whenever serotonin will be affected, yes, there can be fluctuation of mood. So yes, after delivery, just after delivery, mother can have fluctuation of mood. So yes, there is very high risk of postpartum blues. Postpartum blues. There is very high risk of postpartum depression. And there is also a risk of postpartum psychosis. How to differentiate all these? Remember here, postpartum blues is extremely common. After that depression, after that postpartum psychosis. Remember, postpartum blues can be seen among 75% of the mothers after delivery. But this will happen within 3 to 5 days after delivery. Within 3 to 5 days after delivery, postpartum. So what will be there? So yes, there can be, so remember, there can be tearfulness. So there can be sleep related problem. So there can be restlessness, fluctuation in mood, sadness. Okay. So these are the simple symptoms which we can see after delivery. So this is called as postpartum blues. Remember, most important point here, thought of harming baby, suicidal thoughts will not be seen during postpartum blues. So how to treat postpartum blues? Remember how to treat postpartum blues? Only emotional support to the mother. Basically what I'm saying here, that only emotional support, only behavior therapy, that's it. Only emotional support. But when I talk about depression, postpartum depression, this can occur within 3 months. And this can be seen among 10% of mothers. But postpartum depression is very, very serious, where there can be insomnia, there can be severe sadness, there can be irritation, all symptoms of depression. And yes, there can be the thought of harming baby, suicidal thoughts. All these can be there in postpartum depression. How to treat? Remember your behavior therapy also, pharmacotherapy also. And all symptoms of postpartum depression with delusion and hallucination, it will be called as postpartum psychosis. Postpartum psychosis. But remember here, postpartum psychosis will occur within 2 to 3 weeks. So I have taught you during my class a simple mnemonic. There is BPD, after delivery, postpartum blues, postpartum psychosis, postpartum depression. Duration criteria, rule of 3. Postpartum blues will occur within 3 days, psychosis within 3 weeks, postpartum depression within 3 months. Very easy to remember, no? Remember, I keep on telling, right now, I keep on telling every time whenever I take class that postpartum blues, psychosis and depression are very, very important. Very, very important. So this is the case of what? This is, see here, within 5 days. Answer is postpartum blues. This is a case of postpartum blues. And one extra information you can write here related to postpartum depression, that there is a new drug. There is a new drug which is FDA approved for postpartum depression, that is called a brexanolone. Brexanolone. IV infusion continuously for 60 hours for postpartum depression. So I hope now you can understand this question. Remember here, this kind of question related to postpartum blues, psychosis and depression, every time they are asking. Now, a young man gets sudden and irresistible urge to take any action. What it can be said? Remember, out of these 4 options, illusion, OCD, impulse, catatonia. Remember here, illusion is what? false perception of a real object. Suppose after seeing a rope, if a person is getting scared, oh my god, a snake, a snake, a snake, that is illusion. What about OCD, obsessive and compulsive type of disorder, like OCD of contamination, right? What about catatonia? I have taught you during schizophrenia class, catatonia, motor symptoms, right? Okay, fine. But sudden and irresistible urge. Irresistible urge when a person is getting that, do it, do it. If he's not going to perform it, no, he will not be relaxed. That is called as impulsive control disorder. Like I have taught you related to pyromania, right? Irresistible urge to burn something, to set something to fire, right? Pyromania. Remember here, impulsive control disorder, yes, these are injurious to other, these are injurious to self also, right? Like pyromania, kleptomania, irresistible urge to steal something. I have taught you. In the same manner, gambling, right? Pathological gambling, all these are what? All these are impulsive control disorder. So this is a very simple question. Irresistible urge to take any action, this will be considered as what? Impulse. Answer is C, impulse. A man presented to hospital with a drowsiness, ataxia and blurred vision. On history taking, it was found that he brought 2 bottles of alcohol from a local liquor shop. What is the antidote for the treatment? So this is the direct question from methanol poisoning. Local shop, right? So methanol poisoning. What is the antidote for methanol poisoning? It is what? Ethyl alcohol, ethanol. Remember here, for methanol poisoning, it is what? Ethanol. Very easy to understand, very easy question, right? A 38-year-old female presents to OPD with complaints of persistent sadness, sleeping problems, loss of interest in activities, and poor appetite for past a few months, more than 2 weeks, yes? As per her condition, she is diagnosed with major depressive disorder. Which drug is the most appropriate for initial treatment? We have learned so many times. These days, a drug of choice for major depression. First line is always SSRI, selective serotonin reuptake inhibitor. Out of these, yes, answer is what? Fluoxetine. I hope you have solved this question very easily during the exam. SSRI is the drug of choice for depression. First line of treatment is SSRI, right? We are not using TCA as the first line of management because TCA is having so many side effects, right? TCA is not good for the patient, but it is very, very good for the medicos because most of the time they are asking questions related to TCA toxicity. I have taught you multiple times during the class. A person developed sudden hypertensive episode after taking wine, red wine. Family members informed that he was already on any psychiatric medication. So what has happened with the patient? Patient was already on any psychiatric medication, and when he took a red wine, suddenly he had the episode of severe hypertension. Remember, which of the following drug the person must be taking? Again, one question from depression. I have taught you that. Remember, if a patient is having severe sadness, insomnia, anorexia, weight loss, yes, these are the symptoms of typical depression. But if patient is having reversal of biological symptoms like hypersomnia, hyperphagia, weight gain, so now he will be considered as a case of atypical depression, right? For atypical depression, we can use MAO inhibitor. MAO inhibitor drugs, monoamine oxidase inhibitor drugs. So please remember that whenever we are going to start a patient on MAO inhibitor, whenever we are going to prescribe, okay, we have to be very much cautious. We have to give a special instruction to the patient that you are already on MAO inhibitor and you should not be taking cheese, red wine and beer. Why? Why especially we are asking the patient to avoid these cheese, red wine and beer? Why? Because there is something called tyramine. which is indirect sympathomimetic. Remember here, if it is going to get stimulated, no, suddenly there can be severe hypertension. Remember here, see here, along with MAO inhibitor, cheese or red wine or beer should never be taken, because see, suddenly there can be what? Release of tyramine in GIT, and because of that there can be lethal, there can be sudden increase in blood pressure, and that can be very, very dangerous to the patient, which we have learned is called as cheese reaction. Cheese reaction, right? This is called as a case of what? Cheese reaction. In this question, examiner has asked about what? Cheese reaction, which can be because of MAO inhibitors. So what is the drug of choice for cheese reaction? Phentolamine, right? Phentolamine. Very easy question. Last question. A 65-year-old man with a history of chronic alcohol use presents to his primary care clinic. Now he is admitted with features of vision loss, mental confusion, and unsteady gait. He cannot recall about the recent events. Amnesia problem. Okay. Which vitamin deficiency is responsible for his symptoms? Remember, again alcohol. I have taught you a mnemonic, Goa, very, very famous mnemonic, that because of deficiency of one vitamin, which is called as vitamin B1, thiamine deficiency, there can be global confusion, ophthalmoplegia, where there can be horizontal nystagmus, right? A for ataxia. A for ataxia. These are the signs and symptoms of what? Wernicke's encephalopathy. Now remember, every time they are asking Wernicke's or Korsakoff. Remember, because of vitamin B1 deficiency, yes, there can be Wernicke's encephalopathy and there can be Korsakoff psychosis. Korsakoff psychosis, right? These are what? Neurological complications where patient will have what? Memory loss. These are because of deficiency of vitamin B1, which is called as thiamine deficiency, which is called as thiamine. So how to treat Wernicke's and Korsakoff? We have to give what? Supplement of thiamine. Starting 7 days, we have to give 250 milligram OD injection of thiamine. After that, we have to keep the patient on oral thiamine, minimum for 3 months for Wernicke's and 3 to 12 months for Korsakoff. Related to Korsakoff, earlier they used to ask one more question, that patient is making false stories to fill the memory gap. This is called as what? Confabulation. So remember, confabulation is related to Korsakoff, right? But here symptoms go global confusion, ophthalmoplegia, and ataxia. These are related to Wernicke's encephalopathy, which is because of deficiency of vitamin B1 thiamine. See here, this time they have asked 13 questions. Big number, I would say, right? I hope all of you have done great job in psychiatry. And yes, paper was somewhat difficult, but hope for the best, because do remember, you have learned well, you have done a great job, you have worked so hard. Believe in yourself, because even if you are thinking that you would have done so many mistakes, no problem at all. So many right answers you would have done also right now. So hope for the best. I wish you all the best. Thank you so much.